Dental braces have been used as a solution to fix crooked teeth for a very long time, dating as far back as ancient Egypt. Given how prevalent braces are these days, we're sure you know a few people who've had them, if you haven't already had them yourself. Brace yourself, because today on Feed My Curiosity, we're going to explore how braces work, how they're applied, and what different kinds of braces exist. We'll then finish off with how braces are taken care of and maintained, as well as what happens after braces are removed. The main purpose of dental braces is to straighten teeth. This not only improves how your smile looks, but also how your teeth and jaw function. Braces are especially ideal when considering the long-term care of your oral health. Braces straighten teeth by putting pressure on them so they slowly move towards an intended direction. The bone in the jaw begins to adjust for the teeth and their roots to move. Although it's most typically found on teenagers and young adults, braces are becoming increasingly common for older adults as well. It's usually recommended to get braces as early as possible to avoid issues in the future. However, children 12 years and under have to wait for their jaw to grow a little more before they can get braces put on. The oral health of all patients looking to get braces must also be in good shape. Conditions such as gum disease can prevent patients from being eligible to get them. Also, patients with small jaws, severe over or underbites, and wisdom teeth must undergo oral surgery before being qualified to get braces. Not all braces are the same, and there exist plenty of different kinds, depending on the needs of the patient. The most common type is the traditional metal braces. Brackets are attached to the teeth with orthodontic cement and are linked by arch wire, which are kept in place by elastics. Although they are the cheapest option when it comes to braces, they're also the most noticeable. However, braces are undergoing changes to make them look and function better. Not only are they shrinking in size, but those that use stainless steel wires are being replaced with copper titanium wires. These wires can respond to body heat to fasten the alignment process and can make wearing braces less painful. Ceramic braces are another type worn by patients. They're similar to traditional metal braces, except brackets blend in with the teeth by being a similar color or by being transparent. Ceramic braces also tend to be more expensive and require more maintenance and care to keep its transparency or color. Then there are lingual braces, similar to traditional metal braces, with the key difference being that the brackets and the wires work their magic behind the teeth, remaining hidden and out of view. Lingual braces are ideal for actors, models, athletes, and musicians, specifically those who play wind instruments, and other people who are very conscious about their smile. Lingual braces are even more costly and are generally more difficult to clean and maintain. Lastly, there are clear aligners, also known as Invisalign. They are similar to mouthguards in the sense that they're invisible plastic trays that are custom molded to fit the teeth of a patient. Clear aligners are removable so that patients can comfortably eat and drink what they want. However, clear aligners aren't for everyone. They aren't available for children, are fairly expensive, and often require replacing. Once the patient has their choice of braces in place, they will begin to work to align their teeth. In order for the treatment to be a success, regular and routine care is required to keep the braces functioning as intended. Regular appointments need to be scheduled with the orthodontists. With each appointment, the orthodontist will check to make sure the braces are functioning properly and that the teeth are aligning correctly, as well as making adjustments when necessary. When patients aren't visiting their orthodontists, they will be fully responsible for taking care of their braces 24/7. They'll also need to change their diet, as food and drinks that are rich in sugar, as well as sticky and hard foods like popcorn and gum, can damage the braces. Once the treatment is successful and the teeth are aligned the way they should be, the patient will be ready to have them removed. But after braces are removed, retainers will often be prescribed to keep the teeth in place. One type of removable retainer is the Holly retainer, also known as wire retainers, and have plastic or acrylic shape to fit the roof of the patient's mouth or the inside of the lower teeth. Clear plastic is another type of removable retainer which is molded to the shape of the teeth. Meanwhile, a solid or braided wire is a type of permanent retainer and is cemented behind the teeth to keep them in place. If they opt for a permanent retainer, it will be necessary to thoroughly brush and floss around the retainer to avoid damage and cavities. Orthodontic treatment involving braces takes a long time and requires a lot of care and commitment. But if successful, you'll end up with a better smile and will make it easier to maintain good oral hygiene. Are you currently wearing braces? If so, what kind do you have? Let us know in the comments below. If you've worn braces before, tell us your experience with them. And if you haven't worn braces, let us know whether you intend to wear them one day. And if you've enjoyed watching this video and want to learn more things relating to science, technology, history, and tons of other interesting subjects, don't forget to click the subscribe button and the bell icon to be notified when we publish new videos. Thank you for joining us today on Feed My Curiosity. Take care.